pushed by the sutures into the center of this implant.
The Midwest Orthopedics at Rush surgeon used this sponge. It's called the Bear implant. It acts as a conduit to ultimately reconnect the two torn ends.
The ACL is an important part of our knee that helps us to twist and turn, help us to perform athletic type of activity. And recently I've been looking up some new developments in ACL repair. The FDA has just approved that over the pandemic there were several kind of medical advancements that occurred over the pandemic. This was one of them, where the ACL repair was improved upon. The old way of repairing the ACL involved taking a piece of basically a piece of your shin maybe or somewhere else on your body, grafting some flesh material from there and putting it where the ACL is, and kind of helping the ACL to grow, or basically replacing the torn area of the ACL. The drawback to that was you end up having to heal in two different places. The places where they took your flesh from, just for flesh for a lack of a better term, and then they also your knee. So in a way, it's like you're healing in two different spots, because they have to take a portion of your leg from somewhere else, or some flesh material from another part of your leg or body, most likely your leg, to kind of help replenish that ACL, and that required more time for rehabilitation. Now there's a new method where basically they take this protein-based sponge and they kind of lace this sponge with blood. And this sponge being laced with blood, it helps your body basically normalize that sponge into your body, because it's got your genetic material, I guess, for lack of a better term. Again, your material is surrounds this sponge, basically your blood, and then they place it in between the torn parts of the ACL, like one torn into the other. And then what happens is your two distinct parts of the ACL that were torn basically grow together through the sponge, and they reconnect. The sponge basically reintroduces the torn ACL to itself, and those ligaments connect through the sponge, and then the healing the healing material kind of replaces the sponge. So whatever ligaments grow, those ligaments grow that connect the ACL to itself, I guess the torn portion, the sponge basically replaced by that. I'm gonna also share two videos. One is during the clinical trials, which is back in, I want to say 2016, and then the other shows a doctor using the procedure now. It's pretty interesting how it's done. It gives you a pretty good visual, and it kind of shows you exactly what I explained. It gives you like a visual look at what I explained. I think this is a better method just based on theory, because you don't have to heal in two different spots, right? You're only healing in the original point of injury. The first video I'm going to play involves a doctor who is operating on a high school athlete, and he basically uses this procedure on her knee.
Into here and a tunnel into the femur, and then you pass that graft, and then you fix it with screws or buttons.
That's not how Dr. Jorge Chala fixed Brooke's knee.
The ACL will be pushed by the sutures into the center of this implant.
The Midwest Orthopedics at Rush surgeon used this sponge. It's called the Bear implant. It acts as a conduit to ultimately reconnect the two torn ends of the ACL before it eventually dissolves in the body.
So we pass sutures through the ACL stump, then we pass those sutures through here, then the sutures go into the femur, and basically the ACL will regrow in between the proximal and distal stump.
The ligament sits inside the knee, which means it's bathed in synovial fluid, a thick substance that helps the joint function smoothly. But the fluid also prevents blood from clotting, and after an injury, you need to clot so natural healing can begin.
What this sponge does is basically isolates the ACL from the synovial fluid with her own blood. So it basically creates that scaffold that is not able to be created if you don't have that sponge.
At Boston Children's Hospital, Dr. Martha Murray and her team may have found the answer. Bridge-enhanced ACL repair is a game-changing new procedure that stimulates a torn ACL to heal itself, eliminating the need for a tendon graft. First, the surgeon places sutures to stabilize the ACL and the knee. A sponge made of special proteins is placed into the gap between the ends of the ACL, providing a bridge for the ligament to grow into. After the bridge is in place, blood is drawn from the patient. This is added to the sponge, creating an environment for a clot to form, jump-starting the healing process. The surgeon then uses the sutures to pull the torn ends of the ACL into the sponge. Over the next 6 to 8 weeks, the ends of the torn ACL grow into the sponge. They reconnect, and the healing tissue replaces the sponge. Early clinical trial results from this innovative procedure suggest the repaired ACL may work as well as one reconstructed with a graft.
As you saw there, that was the clinical trial for the BEAR process. I want to say it's it's Bridge Enhanced ACL Repair. Yeah, BEAR. Bridge Enhanced ACL Repair. So basically that's where, again, they took the sponge, they inserted it, they used blood to cover it, then used the sutures to sew the ACL into the sponge, and then the ACL basically repaired itself through the sponge. So yeah, I think that's a pretty good advancement to help athletes, or maybe even non-athletes, help you recover from ACL tear. And I think this is a great medical breakthrough in regards to healing ligaments that are injured or damaged. Let me know what you think in the comments, and thank you so much for listening.